You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Wendy J. Ross, the inaugural director of Jefferson's Center for Autism and Neurodiversity. Dr. Ross shares her insights on making medical care more inclusive for autistic individuals, focusing on enhancing access and support through innovative programs. We'll be discussing her pioneering initiatives, including the Autism Airport Inclusion Program and the importance of coordinating health, design, and community engagement. Welcome to the podcast, Dr. Wendy Ross.
Thank you so much for having me.
Oh, it's my pleasure. And this is a new conversation, but it's extremely important because part of an inclusive movement is making sure everybody feels welcome, everybody feels a part of the community they're in, and has a voice in trying to design or tailor that community. But before we go down that route, one thing I love to be able to do is talk about what brought somebody into the field of neurodiversity and where that passion came from, because we all have such unique stories.
Yeah, so I guess my story is definitely unique in that it starts when I was an undergraduate in college. And as a freshman, I found out about a humanities and medicine program where you were obligated to not be pre-med. So I think I always had a very humanities perspective on things. And I was accepted to that program. I think I wrote my essay about coloring with crayons and coloring outside the lines. So I always had sort of a different perspective on things, and I was never a linear thinker. And so then I ended up in medical school, and I guess I just always saw things differently than other people. When I graduated, I knew I wanted to be a pediatrician because I really liked playing. And then I was looking for a fellowship that would involve some kind of advocacy. I actually grew up really poor and I wanted to work in an underserved community. And I found out that at Children's Boston, they had a combination of an advocacy and developmental and behavioral pediatrics fellowship. And so I went really just to check it out for a year. But I just loved the developmental and behavioral pediatrics. It was kind of like being a detective because you'd see a child could do some things and then other things were harder. And then you would try to figure out, how do we take this child's strengths and help support their challenges? And I just got hooked.
I love the fact that your path took you down really trying to empower not just those who are neurodiverse, but those who might not have all the resources to be able to take advantage of what's out there and to get those skills for empowerment or to get that sense of belonging within their community. One of your initiatives in the beginning was to set up that Center for Autism and Neurodiversity at Jefferson. That's unique. I mean, it's something that not every place has. And what drew you to going to Jefferson Health to make that your home base for your projects to set forth?
Well, one of the things that's really special about Jefferson Health is that it's really mission and vision driven. And even on all of our IDs, there's icons, and it's that we improve lives and that we do that by being innovative, being inclusive, and doing the right thing. So right off the bat, Jefferson is just a place that has a lot of heart, which really appealed to me. It's a hospital in the Philadelphia region that serves the most vulnerable populations and provides excellent care. And then the other thing that appealed to me was the School of Design. So Jefferson also has a university. It has, medical school, nursing school, allied health professions, but it also has textiles, fashion, industrial design, architecture, and the built environment. And that was especially important because some of not just my patients, but their families, before anything ever even happens to them, they can't enter a space. So I was really intrigued by this idea of how can we alter spaces to promote, like you said, belonging.
Yeah, and the altering of spaces, being able to kind of find what's important and what's going to actually create somebody's level of comfort and the ability to kind of go in and feel like they're themselves versus walking in as an imposter into a building. That takes a lot of voices. It takes a lot of people contributing to really understand what can we do? What can we change? What is it that we're thinking through just a neurotypical lens that maybe we're not taking into consideration the entire population? What did you learn through this experience? Who did you bring along with you to the table to kind of start breaking down how to create these environments?
Yeah, I mean, these are such great questions. So, first of all, almost everyone on my nuclear team, core team, either has a neurodiversity or has a first degree relative, pretty much. So, that was really important to me. We always ask our population what they want first. That is like a very core principle of what we do. And by that, I mean also family members, right? Because some people have more or less of a voice directly, but when you work with an individual that's neurodivergent, their family is a part, is a part of their environment, right? So, and then it's very important to me to have an interdisciplinary or interprofessional perspective. One is honestly, it's just a lot more fun. And I always learn a lot, but fun is important. And also because when you learn from people with different perspectives, the final project and output is just so much richer. And at Jefferson, because we work with students, I feel like it's super important because you could go to school to become an occupational therapist and just learn that trade and be a great occupational therapist, have a great future. But if you're an occupational therapist that's learning how to create things with designers while engaging a community, well, then you're shaping the future, right? And I think today's future needs those kinds of professionals.
Yeah, and I think you said it. We're all learners through the process. If you went in saying, I know what you need and this is what I'm going to do, the projects would never take off. They wouldn't have the same validity behind them. But you brought a team with you, those who could express their own concerns, their own interests, and their own talents in building this. Was there anything that was unique that you found out that maybe if you had gone with pure assumptions, that you would have been like, I would never have thought that this needed to be done, or this color, or this scheme, or this busyness, or these seating arrangements? Like, are there things specifically that you were like, wow?
Yeah, absolutely. I mean, I have really learned so much. And one example of that is in the new seating we created for waiting rooms, for medical waiting rooms with Miller Knoll. And that came about because right now, if people get overwhelmed, there's this idea of a sensory room, which is not a bad idea. It's a good idea. But what is not good is that it's the only idea, right? And when we think about those spaces, they tend to be segregated. They tend to be designed just for children when there's plenty of neurodivergent adults out there. And so I really felt like there should be other options. And to me, it seemed like seating, everyone has to have seating. Like you might not even have space for another room. And then I began to think about, how would we figure out what would this seating look like? Like what would be the components? Like, do we need a screen? Do we need a sensory component? What would that sensory component be? And one of the things that we tested as we were developing this was movement in the seat, because some seats have movement. And we thought for sure that this was going to be preferred. And I can tell you that universally, in group after group, they did not like it, which doesn't necessarily mean that movement in a chair is not ever good. But in this type of a chair, I think it was very unexpected because people just looked a little shocked and a little freaked out, honestly. And I think that comes down to another really exciting thing about doing that chair was because we could rebuild in different iterations of it and look at it along the way, we were able to include non-speakers, and we did that by videotaping their reactions. And even, some of the people were speaking, but they might have been echoing, or they would seem to agree because they seemed to want to make us happy, but like
Mhm.
you could tell that they looked uncomfortable. So we wanted to make sure that the information we were getting was authentic. So we just used other modalities to make sure that we were understanding.
And I totally appreciate that because that's a voice that oftentimes isn't heard. Are those that don't speak vocally? Is that for some reason we're not taking into consideration their desires, their needs, and their output as much as we should be. So that's wonderful that you were able to go through that process and to think to that level of I need to make sure everybody's included in decision making. But can you walk me through? Because I sit back and I think, all right, I'm going to the doctor's office. I don't always enjoy going to the doctor's office. It can be anxiety provoking. The setup of the office could either promote more anxiety, it could create a sense where I have less trust, more trust. It could affect me in many different ways. So you're starting with the creation of an environment, and that might be the lobby, it might be the entrance, it might be the way that things are set up, but it's got to flow all the way through the experience. So how do you tailor it so that somebody walking in from opening the door all the way through their medical care process is really we are tailoring it to what they might feel is the most important parts of their experience?
I mean, you've made so many good points. And the first one I want to start with is that, when you started speaking, you were talking about how you also sometimes feel anxious, right? When you go to the doctor. And I feel like the kind of programs that we develop do benefit other people. Like when you think about some of our programming, and you compare it, let's say, to a ramp that was created for wheelchairs, right? Other people use ramps, like other people with mobility issues, or even delivery people or people with strollers. So I think it's really important to mention that what we create is for people with autism and or intellectual and developmental challenges, but it really does improve and used another great word, not just access or inclusion, but really belonging, right? So I think that's super important to us. And when I heard that Jefferson was putting up a new building, which is now called the Honickman Center, a few years ago. One of the other things that surprised me was I said, hey, like I heard you're putting up this new building. Could I do focus groups and include feedback from my, the population that I serve from the beginning, right? Instead of doing like a retrofit or an afterthought. And I was shocked. They were like, sure. And I was really excited about that. And so one of the things that we do on principle is that there's kind of two sides to it. One is process based. Okay. So those are the things that are like visual stories or videos, kind of like a know before you go document, things that can prepare you, sensory bags with headphones, fidgets, sunglasses, even. And then the other really important part is educating people that work there, because we need them to have an understanding. We need to dispel myths, and we need to promote strategies, to put tools in people's tool belts, so that they're aware. And that's super important because even if nothing else is working, I mean, I don't know if you've had just a terrible day, but like somebody was nice to you and it turned around your whole day, even though none of those circumstances that made it a terrible day actually were improved, but somebody was nice to you, right? Or understood you or tried to connect with you on some level. So I never want to underestimate the importance of that, right? And then in terms of the design, we got as much say as we could. I mean, obviously, hospitals and health enterprises are also, businesses and have other people that are weighing in. So we didn't do like a complete curb to room, cut out. But we got to put a lot of thought into things like the walls have a tactile component, and we see people interacting with those. Every floor has our chairs on it. And the chairs are based on a Miller Knoll Palisades chair. They have a screen around them, which can help with acoustics and visual distractions. They have sensory armrests, which we tested, and they also have a textile on them, like a herringbone. And we were designing this sort of in the middle of COVID. So the idea that we needed to make sure it was also highly cleanable. So we got feedback about all of that, especially with a screen, right? So you had to make sure there was space to clean between the chair and the screen. So a lot of thought went into that. There are other things that we included. So there are bathrooms with adult changing tables, which you don't always see, but can be extremely beneficial. There's a meditation room, which can be used for a variety of reasons. This building has immersive art, which is light-based dynamic art. We've started studying that in different settings, mostly abandoned chapels in Philadelphia, to look at its impact on health and well-being. We already know that art as a whole impacts health and well-being positively, but this kind of dynamic art is especially appealing in our preliminary information to people who are neurodivergent. It kind of draws them in and can be relaxing. We are working with Special Olympics to create a healthcare passport, which will prepare providers for specific preferences. Like, I understand, but I might not, I might use visuals to communicate back with you, or, please warn me before you touch me, or, sort of practical information that maybe traditionally is not provided. Our rooms also have exam tables that check your weight and can be adjusted in very different ways, which reduces the number of transitions. These rooms also have not whiteboards, like sort of screens, so people can zoom in. So if you have other professionals that are helping you that are not in the building, they can still participate. And also, like, we can pre-program those. So if there's something that's calming for you. So Jeff, like if you came in and you said, I'm really anxious about coming to the doctor, but I like to look at rivers or waterfalls, we could pre-program those screens to accommodate you. So there's sort of all different things in that building, from, when you come in and you can look at the art, to when you go to the room and there's strategies there. We also have a piece of art by an autistic artist, Campbell Smith, which is a model of the building, and it's on our second floor. It's really prominently displayed. Campbell doesn't love the term autistic. He thinks it's taken on a derogatory kind of connotation, so he calls himself an autisarian. But he's a Pew Award-winning artist, and we wanted that piece of art front and center also to remind people of a strength-based perspective.
And everything that you're describing, I think, would be wonderful for every single population out there. I mean, it just makes it so that healthcare, it feels more welcoming, in an environment that everybody should feel, the trust is there. I'm their number one priority. This is me, patient-centered sort of thought. You went through the details of building that out, which I think is amazing. One thing that you hit on, which I work I do some consulting on a hospital-based project right now. And one of the things that you mentioned as far as that healthcare passport, I think is so important. Giving the medical staff that opportunity to know how best to create the environment for somebody who might need some very intense medical care is extremely important. The last thing you want to do is create any sort of increased stressors that could result in some violent or aggressive behaviors at the highest level, but at the lowest level, just enough of that resistance that you're not going to be able to do your job thoroughly as a pediatrician or as a physician in general. What is the feedback that you're getting from the doctors on staff, the nurses on staff, about how this has changed their lives and how it's changed their ability to provide the quality of care that they probably have always hoped to be able to deliver, regardless of environment?
So we have just started prototyping this, so I don't necessarily have all that data yet. But what I will tell you is, in the very thick of the pandemic a few years ago, like 2020, 2021, we did a study where we looked at the data from almost 65 million medical records with Vizient, and we identified that having an intellectual and developmental disorder was actually the number one independent risk factor to get COVID, like high above everything else. Like, you remember when people were talking about diabetes, obesity, emphysema, like those were the people who could get vaccines and no one else, right? And certainly not our population. It was second only to age for dying from COVID. And furthermore, if you were admitted to that hospital, you were 33% more likely to die if you had an IDD, but much less likely to be admitted to the intensive care unit. So that data was extremely concerning, and we leveraged that data with Special Olympics to get the CDC to change the vaccination policy. But what we were thinking about was it was still really stressful to get a vaccine, right? Like even 6 feet apart, it was a stressful experience. And we, just because something was now available didn't make it truly accessible to you. So we interviewed Special Olympians, both in groups and individually, and we got from those conversations sort of the top 10 things they wanted people vaccinating them to know. And those things really did benefit a lot of vaccine centers. It was in a clip on CNN, and people adapted some of those strategies around the world. And some of them were things that we all liked. Remember how many people would get their vaccine and they take a picture of themselves with a sticker? Or, so some of those things were things that, again, appeal to all of us. But I think we got a lot of positive feedback from the vaccinators at that time because it did make their job a lot easier and more possible.
Mm-hmm. No, I think that having more information about who it is that you're working with, having the ability to be able to set the stage and to build that trust in a quick amount of time, it's crucial to being able to provide appropriate medical care. And I love the fact that this was a thought out strategy kind of that you all have that's moving towards even higher personalization of healthcare for populations that, this is a resource that might be almost needed at times versus something that you're saying, well, this is an add-on. It should be a staple. But that's, I guess, the way that I would be seeing it. Is this something that you're seeing some of the things that you have built out, that you have piloted within Jefferson, that you've seen taken on by other providers in the community and learned from your experience to say, why aren't I doing this? Yes, of course, tomorrow, let's start thinking about ways to implement it.
I think sometimes, I mean, because in terms of medical care, you're talking about the care that some people absolutely need, but that we all deserve, right? So I do hope that this is something that people are also taking on. And I wouldn't be surprised. I used to, when I started an air travel program and would train people at TSA and airports and airlines, or I created game day sports programs and I was meeting with the game day staff to educate them. I was really nervous because I thought, oh my God, this is like an extra training that now people have to stay for. Like they're staying later, they're taking time for lunch, and it was really humbling. And this is another example of how you just learn is that people were extremely excited. Everyone likes to help somebody exceed expectations, especially their own. And I don't know why I was so surprised. I mean, this is why we watch the Olympics or the Super Bowl, right? Is that everyone's rooting for an underdog, right? And it makes everybody feel good to help someone else. And so it's really been makes me so happy to see that I'm not alone in sort of wanting to do that.
No, and I can imagine that most people, and myself included, if I'm in an environment where I don't feel competent or I don't feel like I have the tools, is that sometimes I freeze. And instead of trying to figure out how to do something, how to, in this case, make my environment more inclusive for other people, or really understand the perspective or how somebody else perceives what's happening around me, is that it's almost I stay with status quo and I just get through, get my job done, and it's over. Whereas what you're describing is when somebody has that power, that information, when somebody's there to help them take those first steps to kind of start figuring it out, it creates a far more inclusive world because it's allowing people to feel confident that, hey, you know what? This person who's coming in isn't that much different than me. They might be experiencing A, B, or C a little bit different than the way that I would, but there's no reason I cannot compromise my environment to say, all right, it doesn't have to be all about me. It can be about everybody that's coming in, and I need to learn from each individual that's a part of that community. So you've done community projects as well, though. I mean, it's not just within the hospital. You just talked about game day. I know that in the past you worked on doing some work with the airlines. How have you taken the knowledge that you've had as a developmental pediatrician and with your collaboration with so many of the other health professions, but also those supporting professions that are out there that are just making our world more beautiful, more comfortable, more accessible? How have you taken that into the community?
Well, I think, the community is where we live. I mean, we do come obviously for healthcare. When I started the travel program, I had met with the Department of Transportation director at the time was Secretary Ray LaHood, and he phrased it so beautifully. He's like, travel is so much more than getting from one place to another. It's how we experience opportunity, right? So it's really kind of a metaphor. And so travel became really important. And in our travel program, some of the individuals just need to be familiar with the process of going through the airport, but some people really needed clinical support for that endeavors. And ultimately, I would love to collect research to get allied health professionals for providing that support to our population in the community because it's not traditionally covered by insurance companies. And, if I had more money to do research to get all these outcomes, that would be definitely high on my wish list. And the sporting programs, especially for people who are from Philadelphia, that like Philly is like a sports town. And I really think sports are also a great metaphor because when you're doing a sport, you are preparing, which we do with visual stories and education for game day staff. You're practicing because usually we have a hosted experience. And then, you're hoping to play and to really have an experience where you try your best, learn something new, and work together as a team. And those are all core components of our program. And so those are some of the things. We also started a program a long time ago. We were working with museums. It seemed to me that museums were a place where people went to socialize and play, and my patients neither typically socialized nor played, right? I went to the museums. It was kind of funny. Play is actually considered a human right by the United Nations. And so I told them that they were denying my patients their human rights. I thought like for sure that was going to like win the day. But actually what happened was the museum conferences were in Philadelphia. So we put together panels and for the participants. And so the museums did start programs and then the Smithsonian came and we were able to contribute to starting their autism program. So that was really exciting. And it's kind of we do what comes up, what's available to us, where we have the opportunity to try to make a difference. And now you'll see like sports programs exist not just in Philadelphia, but around the country, game day experiences.
Now, and there's so many barriers out there, and those are just a few of them. And I love those. I guess the sensory friendly museum days. I mean, those sorts of things enable an entire group that maybe wouldn't have felt comfortable going into an environment because either it's too loud, too noisy, too many people. There's so many reasons that it enables them to go and enjoy things that otherwise they might have been left out of. And the same thing with sports and being able to kind of go to games, being able to go experience it in the way and cheer for your own team. There's no reason that just because you have a different experience at a game day event or in an arena or being able to play the sport that you can't be a part of it simply because, or that you have to watch it on TV only simply because the environment is set up in a different way. We can accommodate. Where do you see that there are still, those extremely needed barriers that need to be broken down still? I mean, is it finding more restaurants that are able to kind of make sure that they're creating these environments? Where else do you think that we should be focusing some of this time, energy to educate and provide resources?
Well, I think we really need it everywhere. And when you look at the Americans with Disabilities Act, it does apply to our population, but there are no guidelines, right? So, and sadly, the ADA is more of a punitive law than an aspirational law. So no one's sort of like, ooh, I can't wait to spend extra money to be ADA compliant. They're more like, well, if I'm not ADA compliant, I'm going to get in trouble or fined, right? So without guidelines of a best practice that is reinforced with clinical fidelity, so that, if we figure out the best ideas in Utah for how to do, or Idaho for how to do something, then we can make sure that that's delivered with clinical fidelity in, Pennsylvania or New Jersey or California. That would be really something that I would aspire to have or to be a part of. Of course, we also want there just to be a willingness to kind of do the right thing, but sometimes you do need the protection of the ADA as well.
No, for sure. And I mean, as we're looking at creating more inclusivity and you're looking at trying to be able to find ways, and I don't think people don't want to do it. I think that they just don't know how, so they're shying away from doing the right thing by creating an environment where we all feel welcome. Um, but I think that having those education opportunities, I think the outreach that you're doing and just putting it out there, showing people, there are success stories where this has happened, and there are people that can come out and be able to help and even kind of create these designs, I think is important. Um, when you're looking at every single community that you've gone into, and I kind of want to reiterate this process, but you mentioned that, when I go to Idaho or when I go to Utah, I might come up with completely different plans. Is that because you're engaging everybody involved? You're engaging those who maybe don't have a voice historically. You're looking at the culture of an environment. You're looking at what's important. You're looking and talking to the families. You're talking to those who are self-advocates or who are directly influenced. Does it differ place to place based off what you're doing? Do you need that collaboration everywhere?
Well, I think we do need that collaboration everywhere because there's different cultures, but I think what we're seeing is that there are common denominators that can be replicated that are beneficial. So, having materials to prepare the individuals and their families, having people in the community that are understanding and empathetic and have some strategies and are more curious than judgmental, right? Having some ability or flexibility in the environment to create an escape space or a place where people can take a break, even if it's you can't redesign your whole space, right? I think these are things and themes that we're seeing over and over again, that do provide some kind of general guidelines.
Where can they turn? I mean, you've had artists, you've had designers, you've had occupational therapists, you've had so many people help inform you. Where can others go to take advantage of some of these resources so that they can learn from your experiences to be able to create these spaces?
Well, in terms of at Jefferson, a lot of our stuff is on stories like here with you. Some of our materials are on our website. And we also do present, like, I'm really, really excited because in a couple of weeks, I'll be presenting at Becker's CEO and CFO Roundtable for Healthcare. That's the first time I've been invited to speak at a conference like that to healthcare people who are running major healthcare enterprises across the country. So I'm really, really excited about that opportunity and that their interest in this topic. And we just try to get the word out as best we can.
Well, I appreciate the work that you've done, and I think that the creation of safe and shared spaces, none of us own any of these spaces. They're all shared, and that they're really kind of really inclusive and welcoming. I think that the fact that you're out there advocating for that, giving a blueprint and helping people to understand, how can you get there? Or what questions can you ask? Or, what are the processes that made us successful? That's going to benefit everybody. And so I appreciate all the work that you've done. And thank you for coming on and sharing your story with us today, Wendy. I think that this is amazing. And quite frankly, I will learn from it. So hopefully that at our clinics, we can take advantage of some of the insight that you've been able to put out there.
Well, thank you so much for having me. I really appreciate it. And, the last thing that I would just add is at the end of the day, like, you know, being curious and being nice are the most important things, right? And so, this idea of not reacting, but sort of taking a minute to respond to the people around you and to be observant. And at the end of the day, if you're not sure what to do, to just ask.
Well, thank you so much again. Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.